you can take your information from there. Another thing is, most of you who have come from institutions who have filled the registration form, you haven't mentioned your institution. We had a column in the top to mention that. So the problem will be we cannot give you certificates without that information. So at the lunch break, at least one person from your group may go to the respective counter in which you got registered and give the name and details of the institution. Another one is, in the second half, we have a workshop about alcoholism. That will be held in the auditorium of School of Nursing. So before leaving, all of you are requested to have a look at the exhibition as well. So with these words, I will enter this session.
I'll be chairing this session. And Dr. Samir Kumar Praharaj, Assistant Professor, Department of Psychiatry, Kasturba Medical College, Manipal, will be speaking on assessment of patients with alcohol-related problems. You have just heard a talk on psychiatric aspects of alcoholism, and now you are going to hear a talk on how do you assess, how do you find out that a person who takes alcohol is dependent or is abusing alcohol, and when do you need to intervene in such a problem. And the person who is going to talk on this is Dr. Samir Kumar Praharaj. I've got the pleasant task of introducing you to him. Dr. Samir completed his DPM and MD Psychiatry from Central Institute of Psychiatry, Ranchi, where he was selected for the Best Resident Award in 2007. In 2008, he received Samuel Gershon Young Investigator Award from International Society of Bipolar Disorders for his work on transcranial magnetic stimulation.
Good morning, everyone. Today I'll be talking about how to assess these patients with alcohol problems. Okay, I'll be covering the topic under the following topics: the purpose of assessment, the different phases of assessment, a little bit about screening, and the clinical methods that we use to assess, and the little bit about investigations and rating scales, that is the standardized instruments. Okay, why do we need to assess? Obviously, the first goal would be to make a diagnosis so that we can treat these patients. I'm sorry, something wrong with the slides. Yeah. Okay, so first objective is to gather information. Gather information so as to plan and modify the treatment goals. Okay. Besides this important aspect, some other things are also essential, like it helps in building rapport. Rapport is basically the kind of relationship that you want to develop with the patients for, let's say, better understanding of their problems, as well as that will help you in planning management and during your therapy or counseling sessions. So building rapport. So once you build rapport, the clients are less likely to be more defensive about their alcohol-related problems. Otherwise, they won't come out with their alcohol-related problems. They may try to hide. Okay. Also, once you do the assessment proper, you can give a proper feedback to the patients. Like, these are the effects of alcohol. Okay, be it be physical, be it be psychological, or other consequences of alcohol use. Okay. Once you finish the assessment part, before making diagnosis and before starting treatment, also you can monitor the progress towards the treatment goals. Once you have decided, like, okay, he is having alcohol problem, we are starting this form of therapy. Okay, whether he is actually moving towards the goals. Okay, that also can be monitored. Okay, through assessment. So assessment is a dynamic process. Like I said, there are different phases of assessment. It can be before making a diagnosis, like pre-intervention, or before starting the treatment. Okay. Basically what you do is you define the problem. Like what kind of problem? Like in the previous lecture it was being discussed, like harmful use, abuse, dependence. So what kind of problem is there in the patient? So you have to define the problem. Then formulate a treatment plan. Once you made a diagnosis, okay, then you formulate a treatment plan. So what kind of treatment, be it with pharmacological treatment, non-pharmacological treatment, counseling, whatever. Then among various options, you have to select a specific variety, specific form of treatment. then also another part would be to motivate the client. Most of the patients, they will come, they won't be motivated to leave a substance. We'll come to that part again. Okay, once you start the intervention, okay, again to monitor the progress of your intervention, counseling or drugs, whatever. Okay, even after starting the intervention, during the maintenance phase, okay, the person has remained abstinent, but whether he is actually remaining abstinent or there are lapses or relapses, those things you need to assess. So assessment will help in that phase also. So after the intervention also, assessment is important. A little bit cartoon in this one, like this is not a very uncommon thing. Like you'll find like persons, like spouses of many patients, they'll come and say, okay, my husband doesn't drink very much. He takes only 1 glass per day. Okay, so we need to define actually. I mean, what is? I mean, how strong is the alcohol content? Okay, and what amount is a standard drink? Those things we need to define before going into other things. Okay, must be familiar with some of the Indian majors. Okay, like what's a peg? 1 peg is around 60 ml. This is more in reference to the hard liquor. Okay, half a peg would be around 30 ml, and let's say 1 quarter. These are the common lingo that patients will be using. So you should be familiar with these things. Okay, so 1 quarter is around 180 ml of hard liquor. Similarly, half a bottle would be around 360 ml of hard liquor. A full bottle is around 720 ml. Okay, but maybe some, like in other countries, the measures will be different. Like you can get a full bottle around 1 liter or 1.5 liters. So this is the Indian measures that I'm talking about. Okay, similarly, a beer bottle would be around 650 ml. Okay. Anyway, we don't have any standard measures for toddy, which is more common in this part of India. Okay, so how do we define a standard drink? This is essential because once you know what is a standard drink, you'll be able to give precise amount of medications that is necessary to control the withdrawal symptoms. Okay, so a standard drink, because all the alcoholic drinks, they vary, I mean they have been classified, like some like beer, they contain very less percentage of alcohol, like around 3 to 8% of alcohol, whereas spirits like whiskey, gin, vodka, they contain a higher amount of alcohol, around 42%. Okay, so what's a standard drink? So it has been defined as around 45 ml of either whiskey, vodka, gin, rum. Okay, these all have equal percentage of alcohol, around 42.2%. Okay, this standard drink is also equivalent to, like, let's say half a bottle of beer. Okay, or let's say 150 ml of wine. 150 ml of wine would be around 1 glass, the usual glass that we use for drinking water. Again, little bit about the level of assessment before coming to assessment proper. Okay, so there can be 4 levels of assessment. Okay, the first one is a screening or brief screening. Okay, I'll come to those in detail. Then the other levels of assessment gradually more detailed, like when person presents with alcohol problems, then we go for those basic assessment to make a diagnosis, then specialized assessment to treat individuals, like we'll have to decide about the pharmacotherapy, the counseling methods, then reassessment for continuing care. What are the tools that we are going to use for assessment? Okay, it can be either clinical or investigations or some instruments. Okay, clinical is basically nothing but just gathering information or collecting history, as well as examination that would include both physical examination as well as mental status examination. Okay, this is the most common tool that we use in all the cases. We'll use this, will be needed. Some cases we may go for specific investigations as well as specialized rating instruments. So investigations basically we do to confirm substance abuse or establishing the physical damage that is caused by the substances. Okay, and specific instruments. These are basically structured instruments that are used for specialized assessments. Okay, coming to screening. Uh, when do we screen the patients? Where do we screen? So screening basically is done actually when the person is not presenting to you alcohol problems, but these are done in community settings, other hospitals, general hospital settings, emergency rooms, trauma centers, even in some psychiatric settings. They have come for some other problem, but you are screening for alcohol. Let you know, like it will catch so many patients who have alcohol problems. So 5 drinks is equivalent to around 225 ml of vodka, gin, rum, whiskey, those hard liquors. And that would be more than 1/4. So let's say around 1.5 quarters, someone who is consuming on a single setting, likely that he is having alcohol problem. And let's say in terms of beer, if you say, it would be more than 2 bottles of beer. Let's say 2.5 bottles of beer on single occasion. Then probably, as you can see, like there are 4 things: C for cut down, A for annoyance, G for guilty, E for eye opener. So you'll have to ask these 4 questions, okay, to the patients, like whether you have ever felt the need to cut down the quantity of alcohol that you are using. That is one. Or let's say, have you annoyed because of your drinking behavior? Or have you felt bad or guilty about your drinking behavior? Or whether you have taken alcohol early in the morning, just after getting up from the sleep. Okay, that's as an eye opener. So if again, these are only screening questionnaires, you need to assess in detail after that. Okay, it was found like these 4 questions were not sufficient in females. So this particular questionnaire, TS, it was developed specifically for pregnant women, but later it was found to be useful for all female population. So here actually one question has been changed, like instead of guilty, tolerance comes. Okay, so ask about tolerance. How many drinks does it, do you require to feel high, to get high? Okay, and it is scored slightly higher, like it is given 2 points instead of 1 point. All other rest questions like annoyance, cut down and eye opener will get only 1 score. So out of 5, if the person scores for 2, then likely that they are having problem drinking. There are many other screening instruments. I won't go into detail. Like there are specific instruments for adolescents, for older persons, and some other screening instruments like MAS, like Michigan Alcohol Screening Test, a briefer version of MAS, and drug abuse screening test, DAST, or audit, that is alcohol use disorder identification test, or recently developed one by WHO, that is ASSIST, alcohol smoking substance involvement screening test. So these screening tests can be used to identify, these are useful to, this can be applied to like a larger population to screen out alcoholism. Okay, besides the rating scales, what other things that you have? Like you can go for blood markers of alcoholism. So very simple blood tests can tell you that person might be having some alcohol problems. And these things may appear during routine screening, like routine screening for some other problems. Okay, the person has been admitted for medical problems and you find these things and you can suspect alcoholism, then you probe further. Okay, so what are the markers? Like usually hepatic enzymes are elevated, those who consume alcohol chronically. But more specific could be like the ratio of AST and ALT, that is aspartate aminotransferase, which is a liver enzyme, and ALT, that is alanine aminotransferase. The ratio will be very high, like more than 2:1 or 3:1. Okay, then chances are that person is having alcohol problem. Similarly, GGT or gamma glutamyl transferase, another liver enzyme, it is elevated in alcoholism. CDT, this may not be available at all places. Okay. MCV, that is mean corpuscular volume. So the red blood cells will be larger in patients with alcoholism. Similarly, uric acid levels will be higher, specifically if you rule out other common causes like gout. Okay. So these simple tests will tell you that these patients may be having some problem drinking. Also, in some places they use urine drug screens to screen out the common drugs, or let's say even breath erasure has been used basically in legal setups to identify drunken driving, okay, but can be used also in clinical setups. Okay, now coming to assessment proper. Okay, how do you assess? Like screening was something that we saw, like need to screen a larger population. But when a client is brought to you for treatment, okay, so how do you assess? So what are the things that you need to look? So first thing that you should always ask, the first question would be like, why the person has come at this point of time to you? Okay, so you should ask directly. Okay, so why, what brings you here? Why you have come at this point of time? Okay, so what is your problem like? Okay, this will give you some idea, like whether the person has come on his own, whether he wants to leave alcohol, whether he sees his alcohol problem, he identifies his problem, that's why he has come for treatment, or whether he has been forced to treatment by the family members, by legal settings. Okay, so this is very important, because those who are forced into treatment, they will be having anger, resentment, they won't be cooperating with you. Okay, you ask them, you instruct them some things, they won't be cooperating. So you need to acknowledge that one, okay, that he has been forced. Okay, also clarify that now that you have been forced, like what would be my role? Like you clarify your role also as a counselor, as a assessor. Okay, and you should tell them, you should take them into confidence and tell them that okay, I am just for you. Okay, I am not going with whatever they have been saying, but I'll be assessing independently. I'll be with you. I'll be going to help you. Okay, okay, after introducing, then what are the information that you need to generate, need to gather? You need to gather like what is the pattern of the substance use or alcohol use in this case, or and what is the context, like when does he consume alcohol, why does he consume alcohol, where does he consume alcohol, how much? So all these questions you need to answer. So you need to inquire about the past use of alcohol. So starting from the age of onset, like when did he start drinking, when did he have his first drink, alone, with friends, how it was introduced, how much he had, what he had, okay, what was the reaction like, whether he felt a pleasurable sensation or he had some other reactions like nausea, vomiting, those kind of sensations. All these will determine subsequent use. So you'll have to inquire about the onset and how it progressed gradually, how the frequency changed, how the quantity changed, how the settings changed. So you need to assess these things. Okay. Also ask about any history of abstinence. Okay. This will build up confidence in the patient that okay, he will recall like how many times he had abstained, what is the maximum duration of abstinence, what are the reasons for abstinence, why the person stopped consuming alcohol, whether it was self-generated, self-motivated, or it was forced, like family members, they forced him to stop consuming alcohol. Okay. Also, like why did he relapse, why did he restart taking alcohol? Okay, what are the reasons? Again, whether it is because of some peer pressure or it is because of some other factors, those things you need to assess. Okay. So these things will help you in subsequent management plans. Okay. Also assess about the current use. Okay. Besides the past use, assess about the current use. So currently how much he is taking, what is the frequency, what type of alcohol. Okay. So based on those information, you will plan management. Okay. Whether he will be having physical withdrawal symptoms, whether he will require medications for those things, whether he will require only counseling, those things you'll have to decide based on this particular history. Also specifically ask about binge drinking patterns. Okay. Binge drinking is basically periodic bouts of drinking. These persons, they will be consuming alcohol continuously. Okay. They won't have control over the drinking. They will consume till the point of intoxication, till they are blacked out. Okay. Also ask about a typical drinking day. Like in a typical drinking day, how he starts. Like early morning he wakes up, like after brushing he starts with a glass of wine or something. Okay. Ask the sequence of events. Okay. How he consumes alcohol in a typical drinking day. That will tell you about the current pattern of use. Also ask about heavy drinking day, because some persons, they will be having heavy drinking days during the weekends. The pattern will be different from what is usual in the typical drinking day. So ask about a heavy drinking day also. Uh, this is a method, like time like follow back method. It's a method that can be used to document, like in is the alcohol problem, whether there is dependence, whether there is abuse, or it doesn't fulfill criteria for those, it is just occasional use or social use. Okay, based on that you will suggest treatment. I'll just brush through the points. So you'll have to demonstrate for dependence, you'll have to demonstrate increased tolerance, needing increasing amount of alcohol to get that effect. Repeated withdrawal symptoms after stopping alcohol or decreasing the dose, the quantity of alcohol. Okay, you'll have repeated withdrawal symptoms. Also report of craving or that subjective awareness of consuming alcohol. The person is having dependence or not. Okay. Ask about if there is dependence, then you ask about what are the other problems, what are the physical problems, physical consequences. Again, I won't be covering this one because I think this is scheduled to be covered in a later session. So there can be several medical problems like liver dysfunction, pancreatitis, gastritis, cardiac disorders, nutritional deficiencies, alcohol-related brain damage, and in females like pregnant females even can give rise to fetal alcohol syndrome. Okay, I'll be focusing some other aspects also besides the physical damage. What are the other damages that can occur? Risk-taking behavior. This is very frequently seen in alcoholic patients. Like these patients, they will overdose at times. They will have periods of intoxication or blackouts. Blackouts basically when they don't remember, don't recall what happened the previous night when they were drunk. Unprotected sex. This is very important. They should always inquire about this thing because these persons, they are highly likely to engage in sex with several partners, and that can increase the risk for HIV or hepatitis B, so many other infections. Okay, gambling. Gambling is not very uncommon in our part of India. Okay. Okay, in Western countries it will be more to do with casinos and other things, but at a lower level gambling is not very uncommon in villages also. So you should specifically ask about gambling also. Drunken driving, accidents, these are also not very uncommon in alcoholics. Should specifically ask about these things. Doesn't end there. Legal problems are also not uncommon in these groups. So should specifically inquire about any current pending cases, any specific cases against the persons, and whether they have come through legal channel, whether they have been forced through legal route, or even to some patients, some persons may be involved in even organized crime like drug peddling. Should specifically ask about that one to save the patient also and also to save yourself. And specifically ask about whether they have been convicted for any alcohol related problem like drunken driving or any other behavior related to alcohol. Also inquire about the vocational and the financial background of the patients. Okay. Many of the patients, they won't be having stable jobs, they won't be having financial security. Okay, inquire about those things also. Ask about accommodation, whether they have stable accommodation. Any change in the work performance, whether they have been able to carry out their job properly or there is any problem in that one. They remain absent for a long time, do not attend to work properly. They may be demoted sometimes. And also, this is very important, specifically ask about whether the current occupation has anything to do with alcohol. Patient comes to you, you treat them, later you find that he was a bartender, he goes back to his bar and starts drinking again. Okay, so you'll have to ask specifically about those things also. Okay, inquire about the financial burden. How much burden alcohol has caused. Okay, there might be debts that the person has to repay. Okay, assess about the family background. Okay, and the social support. Okay, whether there are anyone in the client's life who are significant others, they take care of the patient. Also assess the level of support, whether the persons are there, but they are not supporting the patient. Whether the support is positive, it is negative. So those things also you need to assess. Assess about the family history of alcoholism. This is very important. In the previous lecture, it was repeatedly being told that genetic influences, biological influences, the vulnerability is very important. So ask about the family history of alcoholism. So if there are positive family history of alcoholism, likely that there are some genetic influences operating. Chances are very high that the person will have high rates of alcoholism. Also ask about child abuse, domestic violence, marital distress, any other unhappiness in the family during the childhood. These are very important. These are some of the factors that can lead to alcoholism in those who are vulnerable. Okay. Also inquire about the social contacts. How many contacts they have, friends, other organizations, clubs, of which actually the person is a member of. Okay. So basically you have to assess the social network. This particular network is going to help you planning the treatment and also during the therapy also. Okay, involvement of the concerned others. Specifically ask about how the other person, specifically the spouse or let's say the parents, how they view the client's alcohol problems. Whether they view it positively, negatively, in what way, whether they criticize, any differences in opinion. Like a spouse will be having a different opinion and the parent will be having a different opinion. So you have to assess the differences in opinion between the family members. These will help you deciding the management plan. And what are their concerns, the immediate concerns. The immediate concern might be totally different what you are seeing. Like you might be more interested in the liver dysfunction. The immediate concern of the family member or spouse would be totally different. So you'll have to ask about the immediate concerns. And what are their expectations from the treatment? Because if they expect too high, that okay, you'll give some magic treatment, magic drug, and the person stops drinking. It doesn't happen. Besides this, another important concept that you want to introduce is the concept of codependence. So many times you'll see like the spouse will be, the wife will be nagging, will be very irritated because the husband is drinking always in a drunk state. Okay, but sometimes when the husband is in trouble, like husband is intoxicated, lying someone, the wife will only organize, will carry them back home, will nurse them. So these are some of the behaviors which are enabling behaviors. These behaviors increase the level of alcoholism. Okay. So you need to identify these behaviors also, because these behaviors also need to be cut down so that the problem of alcoholism comes down. Okay, you shouldn't only focus on the negative aspects, also focus on the positive aspect of the patient. So inquire about the coping skills. So what are the strengths and limitations of the patient? Okay. So basically whether he is able to cope with stress in previous situations or with intense mood states, or while communicating with others, whether he is able to communicate his feelings, like when he want to refuse drink, he can refuse, or he is not able to refuse, or let's say coping with other things like other triggers, specific triggering factors like cues and other things, or cravings of during the withdrawal states, whether he is able to cope with them. So coping skills are very important. These things you should always assess in the patients. There are specific instruments also available. One like situational confidence questionnaire that can be used. There are many others that can be used. So you should always assess the positive, the strengths in the patient. Okay. Also assess about the interests and hobbies. Again, you'll ask like why these are important in this context. Okay. So basically ask about the current interests. What are the current interests in the patient? Or what are the other things that he used to enjoy in the past but currently because of alcohol problem is not enjoying. These will be helpful during the therapy part. Okay. When you can suggest these things as a substitute for drinking. Okay. Because they used to enjoy, get pleasure out of those activities. So you can ask them to continue with those things now. Okay. Instead of concentrating on alcohol. And also these will be ways for meeting new friends, the friends who are sober. Another important concept that I want to introduce you is locus of control. So locus of control is simply saying like extent 2 is the individual belief they can control the events that is occurring. Okay. Some persons will say that okay, whatever happened to me, it is because of me. Okay. So they have an internal locus of control. Okay. They don't put blame on others. Whereas those who have external locus of control will say that, okay, it's because of some event, something happened, something was there, some other force, some fate. Okay, so they will start blaming their things. I mean, whatever happened to them, they will start blaming on others. Okay, which is very common in alcohol patients. Okay, so you need to assess this one specifically. So those who have external locus of control, our therapy during the counseling and other therapy, your aim will be to revert it back to internal locus. The more and more the locus will become internal, chances are that will remain abstinent higher. Okay, now coming to the most important part, that is motivation, the level of motivation. Okay, there are several stages of motivation that has been described. Okay, I'll describe one by one, like pre-contemplation, contemplation, determination, action, maintenance, or relapse. I'll cover one by one. So this is the first stage, like pre-contemplation stage or denial stage. Usually at this particular stage, the client is not considering changing. He doesn't want to stop consuming alcohol. Okay. So specifically seen when the person is brought by or forced into treatment by family members, they'll be saying no to everything, no to treatment. Okay. They do not usually attend treatment centers unless they are forced. And they will require very careful motivational strategies. Usually they don't accept your feedback and other things. You'll have to tell them about the consequences, the harmful consequences of alcohol. So basically it will be more of an information giving stage. The next stage in which a client becomes more aware of the costs of drinking and using the drugs, okay, and the benefits of abstaining from alcohol. Okay, so basically he is an ambivalent stage, maybe. So maybe he wants to stop, maybe he wants to continue. So this is the most important part. Here actually the counseling roles come into play. So basically your aim would be to tip the balance towards change. Okay, so motivational interviewing is a technique. Maybe in subsequent lectures it will be covered. The third stage would be the preparation or determination stage. Here the person is preparing to take action, maybe within the next month. Now he has understood, okay, alcohol is causing problem, so I want to stop. But not now, maybe at a later date. Okay, so they are ready, they are motivated. Okay, so they are believing on the negative consequences. So again, you'll have to reinforce their beliefs using motivational techniques. Okay, action stage. Now that they have decided, they are actively engaged in these particular behaviors to stop drinking. Okay, so basically they are doing it. So it's the action stage of motivation. You don't have to do much in this stage, but you'll have to again prepare them for the subsequent, like how to maintain on this particular stage. Maintenance stage again. So basically they are continuing to abstain, they are living this particular thing. Okay, so it's well and good. Now you'll have to tell them, like, look how you have been, like you were earlier not ready for like stopping alcohol. Now that you are into this particular stage, so look back and see like how you have progressed. So those things you can do at this particular stage. But some patients, they will again relapse at this particular stage. Again they will enter the cycle. So a typical patient basically will go through several such cycles before abstaining for a prolonged period. Will relapse several times. Some clients may stay at a particular stage for a longer period, some may stay for a shorter period, but invariably they will be moving back and forth. Some will require several such cycles, so then they remain in that particular cycle. Okay. So you'll have to do a proper assessment to find at which stage of motivation the person is currently in, so that you can plan your management. Okay, little bit about the rating scales. There are many rating scales. I won't go into detail about rating scales. A lot of things has been written about the rating scales. They're available and they can be used during assessment. So one instrument that is used is addiction severity index. It is a very comprehensive one. It not only assesses alcohol but also other substances as well. Then there is alcohol problems questionnaire, severity of alcohol dependence questionnaire, specifically to look at the severity of alcohol use. Okay. And short form alcohol dependence data scale, severity of dependence scale. These are some of the rating scales, structured instruments that can be used for assessment. Similarly, investigations. Now basically once you have made a diagnosis, clinical diagnosis is assessment, most of the things are clinical from history and examination, but you need to do certain investigations like complete blood count, okay, that is routinely done in most of the patients. Liver function test, again, how severe liver has been affected. Similarly, blood glucose, lipids, renal function test, these things are important because many of the comorbid conditions like these patients may be having hypertension, diabetes, so many complications, so you'll have to look for those things. Some persons who have hepatic damage and all will have to go for ultrasound of abdomen. Similarly, upper GI scopy, lower GI scopy, using endoscopes to see whether there are complications like varices. Then specific investigations like EEG if you are suspecting seizures, or even nerve conduction test if there are complications like nerve damage because of alcohol, or even if you are suspecting some brain damage, then you can go for neuroimaging methods like CT and MRI. Those things, sophisticated investigations may at times be required for proper management of the patients. Okay, with this I'll end. So thank you for your patient hearing.
Like before I pass on the discussion to the floor, like I've got a doubt. Like you mentioned about the screening instruments. As we know that many of the screening instruments are highly subjective. And unlike in depression or schizophrenia, where you're dealing with patients which are not motivated to come for treatment, how effective are the screening instruments like CAGE or MAST in this particular population?
Yeah, actually, you're very right. Actually, because this is one problem that we encounter. Like all the instruments, because most of these questions will be asking, or some self-rated questions. There is some bias. Is there because some patients they may not come out with these particular things. Anyway, but several studies they have found like even the client reports are not that they don't have that much limitation. Actually, they have been successfully used, and it's basically a screening instrument like case questionnaire and all can be used as very basic screening instruments. Like there are some better ones also, like audit and all, which are more effective at identifying. Case questionnaires may miss many patients, but like you rightly said, like at times you'll find it difficult. Like some patients they may not come out with things.